So I'd like to ask both of you, how can engagement and multi-stakeholder dialogue be facilitated in our current atmosphere in public health and global public health?
Yeah, what we are facing very often, let's say in controversial issues and controversial discussions, is that everybody stays in his or her bubble. So let's say, trying, let's say, to, no longer to speak with each other. And I see it as my task as a university professor to bring multi-stakeholder or to bring stakeholders together on the same table in conferences, that they can talk to each other, exchange their arguments and their views. I think this is of utmost importance once you want to get things changed. Otherwise, let's say, the bubble strategy does not lead, let's say, to the goals we are trying to achieve. So only a common start, a common way of tackling the problem, having a common goal. And I'm sure we do have the common goal. It has been mentioned several times throughout this webinar that we are trying to reduce the number of tobacco-related deaths, premature deaths, and that we are trying to reduce the health damages that are leading to these deaths. And I think this consensus is easy to, let's say, to work with and to base on, and this should give us the chance to bring people together. I do conferences, we do position papers, manifestos. We're doing, let's say, lots of workshops, webinars, and all these things is the attempt to bring stakeholders in one room, in one seminar at the same table. And this is promising for, let's say, persuading people, convincing people of less harmful products, less harmful strategies.
Thank you, Heine. Derek, how can we accelerate engagement?
Well, I think it's interesting, we're talking about whole of society approaches exactly when the World Bank is working on a report explicitly to look at whole of society approaches to address non-communicable diseases. And they have recognized that unless we go down that route, we're not going to tackle the fact that there are multiple players with multiple perspectives who all need to be at the table. And so I completely agree on the importance of it. I would add a little twist and to say that I think there's one group who absolutely have to be in the leadership, and those are people in the health professionals, and particularly those sitting on the epidemiology and the science. And secondly, there has to be an early start point to agreeing on what is the base science and knowledge that we have. And for that, I think we don't have to go too much further than look at the UK government, the NHS, the New Zealand government, and of course, the FDA decisions on what constitutes something that is appropriate for the protection of public health. The label they're now giving to a product that comes from a snus category, an e-cigarette category, and a heated tobacco category. If that regulatory body and a number of governments have already thought about this, we don't have to continue the thinking about what truly makes sense from a scientific point of view. The convening is actually to counter the misperceptions and to show the benefits to the different sectors around the table who need to be there. And in general terms, I certainly think that the large employers, the major insurers, and in fact, the government funders of all the groups, they really need to be at the table early because it's in their material interest to actually ensure that we reduce the death and disease and the consequent costs and economic impacts of it.